there's a big misunderstanding about what a stroke is. People think it's something to do with the heart, which is not. Stroke is when there's a damage to the brain. It happens fairly suddenly, and there's a damage to the brain which results in loss of body function, i.e. most commonly what people say is a paralysis. When a stroke happens, the first thing people will realize is that one side of their body will stop working, so which people see as a weakness. So in the community, if you are not sure if somebody is having a stroke or not, there are a few things which you can do to elicit that weakness. The first thing we say is to look at their face, ask them to smile to see whether there's an asymmetry in the face. If one side is not working, the other side will pull the face to that side. And then the next step is to check the arms. If you're not sure whether the arm is weak or not, you can ask them to raise the arm, and if the weak arm won't either come or will just slowly drift, and the patient may lean to that side also. And the other thing is to check the speech to see whether they can speak fairly clearly, whether they can find the words, whether they're slurring, etc. So we call this test the FAST test, F-A-S-T, face, arm, speech test. And T, you can take it for time as well, because treating the patients in time is very important. So the brain damage, which I said, which happens in a stroke resulting the paralysis, happens due to two things. One is the commonest things, about 85% of the time. What happens is there's a blockage of blood going to the brain or part of the brain, which is due to a blood clot blocking the blood vessel which is taking blood. And the blood clot may come from the heart or from the neck, or it may happen inside the brain itself. But what it does is it blocks the blood vessel, and then the brain tissue which that blood vessel supplies is starved of blood, i.e. oxygen and nutrients, and the cell starts to die. And any tissue in the body without blood will die within a certain amount of time. And the brain cells, we roughly think, have about 4 to 4.5 hours until they completely die because of the blockage. Rarely, the other 10 to 15% of the time, this brain damage could be related to the bursting of a blood vessel, where because of the pressure most likely, or a weakness in the blood vessel wall for whatever reason, the blood vessel may burst, and then blood may leak out, causing damage to the surrounding brain tissue. So those are the two commonest things which happens when a stroke happens inside the brain. We don't have time at all. As soon as possible, telling 3.5 to 4 hours before all the brain cells are dead, but that shouldn't take you to think, okay, I have a little bit of time to decide what I'm going to do. The sooner you act, the more of the brain cells you can save if you actually unblock this blood vessel or try and contain the bleeding which is happening inside the brain. If you leave it even half an hour longer than a normal person, for example, somebody has a stroke or a blockage, gets treated, get the blood vessel unblocked within an hour, will have a significantly better outcome than somebody having the blood vessel unblocked at 1.5 hours or 2 hours. But in general, we tend to treat everybody within about 4 to 4.5 hours. Beyond that, treating is not very useful because the damage has already occurred. It's very similar to a heart attack. When you have a chest pain, you don't wait around, you know that you have to go to the hospital, get this unblocked. So likewise, you can actually call a stroke a brain attack, like similar to what happens in a heart attack. As I said, the commonest problem is a blockage. You have to unblock it. It's a basic principle. So the blockage is due to a blood clot, as I said. So there are two ways. What we do here is to try and dissolve this clot, first with medications, with an injection, which we can administer fairly simply through the veins in the hand. And if the clot is large, sometimes the injection may not be adequate to dissolve it. If that is the case, we might have to mechanically put a stent into this clot and to take it out. Very similar to what we do for a heart attack. If there's a blockage, we stent it. It's a common principle. So similarly, we can stent it and take the clot out to unblock it. So unblocking will establish the blood flow, and we can save as much as cells as possible. So the time is important. So if the reversible damage has to be stopped, and whatever the recovery, we have to make as much as possible. The other rarer case, when there is a bleed where the blood vessel has burst, you have to act very quickly to try and arrest that bleed to stop it from getting bigger. So that also as soon as possible, basically.